Good morning, good afternoon, good evening, good night, depending on when you are joining us. I'm really pleased to be joined by Sandra Pycock, and we're going to be having a little bit of an introduction to what we mean in the SEND system and more broadly by health. And we're going to be talking about it as part of the work that Surrey as a wider system is doing to evaluate, to do a self-evaluation to say, how are we doing? What needs to change? What needs to be kept? So, Sandra, welcome, and thank you so much for taking the time to join us.
Thank you. It is lovely to be here and to have an opportunity to have this conversation.
So I think one of the things I'd love to start with, if that's okay with you, is to ask you to introduce yourself. We often, as parent carers, we see the system as a bit of a faceless, enormous monster. And one of the things that I really enjoy doing as part of my work at Family Voice is giving people like yourself the opportunity to say, hi, I'm a human being.
Yeah, absolutely. You too. Hi, I'm a human being. So hi, I'm Sandra Pycock. So my role is I'm the Associate Director for Children and Family Health Surrey, which I can go on to explain a little bit more later. I've worked in Surrey for a number of years in different roles, etc. I've worked with children with additional needs for very many years. I'm a speech and language therapist by professional background. I was inspired to come into that profession having had special educational needs within my family. So my brother had additional needs. So from a very young age, I was very mindful of those needs of those children and the impact on families. That inspired me to become a speech and language therapist. It's inspired me to be part of children's services. And so here I am. And that's a little bit about me.
Thank you so much. I'm always quite humbled, I suppose, when I meet professionals like yourselves who are willing and comfortable to share in their own personal experience. And I find it more often than I would expect. I come across people like yourselves who actually, you're doing this because actually in a way you're part of us, you're part of our community. And it just makes a huge difference to, I think, our understanding as parent carers of these are people who care and who do understand. They may not be in my situation, but there is something, there's a connection, isn't there? So
absolutely, yeah, and you know, everything's different for every family. But I think that experience, it was quite a while ago now. We're both adults, but actually, really sort of, I suppose, laid the path in terms of my own personal career direction, but also my sort of personal value set in this space as well.
Yeah, wonderful. So we're going to be talking about this health world, and we thought it was quite a good idea to start by trying, I suppose, to pin down what is it that we mean by health, because it's huge, isn't it? And when we were preparing this, you sectioned it off in a way that I found really helpful. So I wonder if you could do that.
Absolutely, I will try and remember what I said. So yes, I think, you know, you often hear, you know, health services, how are health engaging, etc. And health is a sort of a large monolith of lots of different organisations and can be quite confusing for people, confusing to navigate, etc. So my sort of simple explanation was to sort of categorise it into big chunks and to think about it as the acute chunk of health. By that I mean, you know, the large hospitals, places in Surrey like Ashford and St Peter's, the Royal Surrey Hospital, Epsom. So that's what we often refer to as an acute provider, an acute service. Obviously those services have inpatient facilities and outpatient facilities, offer services for children and for adults. So those are the one chunk that I called sort of acutes.
And could I ask you, would that include the more specialist hospitals, for example, the Great Ormond Street or the Royal Brompton, or those where we know that some children have very specific and complex health needs, so they get sent up to there as well?
Yeah, absolutely. This is where it gets a little bit more complicated, a little bit more granular. So you have your local acute systems, so those hospitals I've mentioned, but you would also have specialist acute settings, sometimes referred to as tertiary centres, third centres. So a Great Ormond Street, the Evelina, are hospitals that specialise in certain sort of Diagnosis for children or support for children. So yeah, you've got local acutes and then national tertiary acutes as well. Hence the reason this is all getting complex. Another aspect of health services is GPs, one that will probably be most familiar to families in terms of when you think about local health services, you think about your local GP practice, etc. Sometimes they're referred to as primary care. So again, just to be aware of that, but GPs as a whole, and they have, obviously services that are GP focused, but may have district nursing, may have practice nursing in there as well. So each of these large chunks, as I explained, have little avenues off. My third big chunk is mental health providers. For Surrey, obviously Surrey and Borders Partnership Trust is our key mental health provider for both adults and for children. We've got the new MindWorks model within Surrey, which is the sort of children's mental health side of things. And then I come to, I suppose, the sort of quadrant with that is ICT, which is sort of community services. Again, these are both adults and children. So an adults community a health provider would be the local hospitals, places like Woking Community Hospital, Walton Community Hospital. So it's not a big acute hospital, it's a localised community hospital. And obviously our adult services also run community services in terms of district nursing, community nursing, therapy, outpatients. And then within it, I'm getting to where I sit, our children's community services. And this is what Children and Family Health Surrey provide across Surrey, is NHS Community Children's Services. So that just gives a little bit of context, but I actually do appreciate, I think it is a confusing sort of landscape. All of it's connected, so it's not really sort of separate entities. We do speak to each other, and of course with children's, the bit that's sort of not health but is very important to us as a partnership is the local authority and education, social care, etc. So although I talk about components being this is a group that might be acute or community, there are connections between them, but absolutely, I do understand. I've worked in it for 30 years, and sometimes it takes me a little while to explain it all as well.
It's really interesting, and I think having those categories helps. At the same time, you start seeing, or I suppose better understanding maybe why, as a parent of a fairly complex child, you might be quite frustrated at times because you feel that people aren't talking to each other, because they do work in quite different systems. And as you said, we said at the beginning, we've got the Surrey provision, but then we also have national things where some children really need additional support. And getting everybody to talk together, let alone talk the same language, can be really challenging, can't it?
Yeah, absolutely, and sort of different systems in different respects, but I think fundamentally it comes down to people in those sort of systems. And actually I think there is good sort of networking between, we as a service would get referrals into our service from GPs, we'd have that connection with them. It might be then a child would see one of our specialist medical practitioners, who would then refer on to the Evelina, and so the connections are built around the child, and the network sort of builds. But really yeah good.
So in this we're going to be doing a series of little videos and focusing on this idea that Surrey is looking to itself to say, are we doing a good job for children with additional needs? And one of the things is that we've heard at Family Voices that there's a real desire for parents, for families, for young people themselves to be part of that process. And so we felt it was really important to say to families, we want to hear. So we're going to be talking about this a bit later, but I just wanted to mention that what we're going to try, we've already had a conversation, you and I, about making sure that we do little videos like this about each of those segments in one way or another. And today, we're going to be talking about that children's community health service and what you offer and what it is. And I know you wanted, and I think quite rightly, we were going to talk about the fact that you are a universal service for every child in Surrey, aren't you?
Absolutely, and I think, you know, that's sort of what sort of makes us, you know, unique in that aspect in terms of sort of children's services. So the majority of services that we offer as children and family health, are what we call universal services. So we will see every child and offer a service to every child in Surrey. So this is from birth through to 19, and most families would know our services probably via their health visiting route. So health visitors make contact with families at an antenatal stage. There's good transfer from midwifery. Then the health visitors go through a series of what we call sort of mandated checks, and families may remember, or they may be going through that at the moment, but a new birth visit, a visit at 6 to 8 weeks, one at 1 year and 2.5 years. So regular sort of check-ins to have a look at the sort of development of that particular child. So I think most people will perhaps recognise that and think, oh yes, I do remember a sort of health visitor coming out. Obviously that's for children at sort of preschool ages. Our services also operate universal school nursing services, and there are national checks that we participate in terms of actually keeping an eye on children's development as they progress through school age. So I think it is worth sort of saying that, to say that is the majority of our work. However, obviously, some children have additional needs, and we have the services that we offer also provide specialist medical, nursing and therapy support for those children with additional needs where they need it. But I think for me, the connection we have with the universal and the sort of specialist services for additional needs is really important, because obviously we all want to, you know, meet children's needs and families' needs at the earliest opportunity. And I think with our links with our health visitors, etc., we're often in there first for a child with those sort of developmental needs, and it might be the health visitor who's having that conversation with a family where, you know, family members are saying, just a little bit worried about, or they're not quite making this progress, and that's where we can start to have those sort of conversations. And you know, really we encourage parents to be reaching out and using those opportunities when, you know, health visitors come to visit, or the school nurses are visiting in schools, etc.
Can I ask, you mentioned mandated checks and those kind of times. We hear from quite a lot of parents who, let's say with an 18-month-old, are beginning to have some concerns of, you know, they could be a health need, could be a developmental thing, and they will say sometimes they're really worried because they've got to wait another year before they're likely to see their health visitor again. What would you say to them? Do they need to wait, or is the system wanting them to come earlier if they have a concern?
Absolutely, we want them to come earlier and have the concern, and yeah, come and speak to us. So we have an advice line that's a 9 to 5 days a week, 0 to 19 advice line. I will find the number in a minute and give it to you at the end. So
we'll put it down in the description.
I was going to say, let's put it at the end, or something like that. So we would really encourage people, because we are aware. So the mandated checks, I suppose, are the core service. It's not the only service. So you're right, you know, we would offer something around a 1 year and then a sort of 2.5 year. But actually that gap in between is quite important in terms of very early development, and picking that up. We've recently launched, actually in response to that, a new type of service which you may have heard about. I think Family Voice have done some webinars on our community health early support team.
And actually it was a really lovely piece of collaborative work, I think, because we worked with that team right at the beginning, didn't we? And to try and determine what would be most helpful and how with parents.
Absolutely.
And we've had amazing feedback, and I think it was in response, wasn't it, to those families where
absolutely, yeah, it's saying exactly what you have just sort of said. 18 months is you know, a key time, and you're starting to sort of think about it, and so we were picking up that, we were having conversations. I mean, you're absolutely right, it was a really good collaborative piece of work, because actually I know you guys helped us with interviewing actually the practitioners that formed part of that team. But it was to pick up those children and those sort of family concerns where, you know, parents, families were sort of saying, yeah, I'm just a little bit sort of concerned, and actually going in and working with them, supporting them on the sort of things that they can do, sort of almost sort of holding their hands through the next, you know, few months, rather than, you know, there is a lot of online support that we provide through our website, etc. But sometimes you need just a face there, just to sort of talk you through some of that process, which could, you know, they can also help signpost onto other services if that's required. But actually, a lot of the feedback that we are getting is that early support at that particular time is enough to give families the confidence to sort of progress and children to blossom.
Yeah, lovely. So, well, you've got that universal offer, which is going to be presumably really key in helping identify those children who have additional needs. And I'm sure that as part of this self-evaluation, I imagine that you'd quite like to hear of experiences there, actually. Who helped you figure out that your child needed some support? Or, you know, was it missed is the other thing, I suppose.
Well, absolutely. I mean, yeah, for me, these self-evaluations are just such an excellent opportunity as sort of partners, and, you know, absolutely families are the partner in that, to reflect on, you know, what's worked well, because, you know, there's some successes, and, you know, we need to learn from those positive stories, but perhaps what hasn't worked so well, what are the challenges, and to ask the question, you know, what could we have done differently? How could we work together in a different way to achieve a different outcome and a different impact? So I hope it's one of the things that Children and Family Health bring to sort of the SEND partnership, is that focus on the early support, the early intervention, how we can support families in those very early steps, if that's the, you know, the route that they are going down. And, you know, it may be that, you know, a family ends up with a child that accesses you in the full-blown specialist support for an educational healthcare plan. They may not, but we are still there. We are still there supporting them.
Yeah. So the other thing, so there's that initial thing about your role in early identification and early support, and then of course for children who have an ongoing additional need, often you play a really large. It's interesting, you were saying that your biggest role is that universal offer, and I think for a lot of our families, your role is a really important part of that child's life, because you are the people that will provide various therapies, aren't you, in particular?
Yeah, absolutely. So yes, we provide those sort of specialist supporters as well. So you know, within the services we offer, we have the sort of specialist medical support. People will know that as their, you know, the developmental paediatrician, the community paediatrician, and I know that we've spoken about having a sort of a separate chat webinar like this, specifically around the sort of the doctor's sort of support in the process with SEND. We've also got specialist nursing services that are across Surrey. Not sure if I said that, you know, obviously this is a Surrey-wide service. So we have specialist nurses in all of our special schools that are attached to each of the special schools. There is a children's continuing care specialist nursing service team, and community nurses for those children with really sort of, you know, those sort of complex sort of medical needs. It may be end of life care, it may be that, you know, the child is a ventilated child at home, is being educated at home. So we have a really great team of providing community-based, home-based support for that sort of specialist nursing aspect. And then of course you sort of say, which, you know, perhaps a lot of people think about when it comes to SEND, is the therapies. It is often an area of sort of concern and anxiety, but what we have within sort of Children and Family Health Stories is we have the sort of three sort of key therapies. So we have speech and language therapy up until the age of 5. So speech and language therapy, once a child becomes more school age, is picked up by the local authority speech and language therapy services. What I really hope is that, in a way, who delivers it doesn't really matter. It is a pathway for children with speech and language needs. So I really wouldn't want sort of parents to be concerned about, you know, who's providing what, but just for this purposes, children family do the bit, particularly for the under fives, and then we liaise closely with our local authority colleagues. Occupational therapy is all age through obviously we have early years, primary, secondary, up into FE if they're maintaining into schools, and physiotherapy as well, that is all age. And just to sort of say that the support from those therapies isn't solely for children with with educational healthcare plans. It's for children with therapy needs. So it may be that a child has additional needs, they don't have an educational healthcare plan, but their needs still can be met by our services.
That's really important to hear, I think, isn't it? And it's really important when we're speaking to parents about a self-evaluation of the SEND system, that obviously we are speaking to families whose children have an EHCP, but we know that for every one of them, there's at least 2 or 3 or 4 or 5 children with additional needs without an educational healthcare plan, and who, as you say, may well be receiving physiotherapy or occupational therapy from you.
Absolutely.
So I think it's something that feels really important.
Yeah.
Can you tell us, because in that physio and OT, which are the short words we use, aren't they?
Yes.
Do you deliver those in schools or in hospitals? What will the experience of families be? And will they know that they're seeing someone from Children and Family Health, or does the child just go to school and have physio delivered? How does that work?
Yeah, no, absolutely. It's a really good question. So I think it would be dependent on the child's needs. Although I have to say, you know, because most children are in school for most of their day, that is where we will provide the service, because that is where the child is, and that is naturally where they are learning, etc. So we would see children in school. That's not to say that we wouldn't see them at home. We can see them at home as well. And I think because perhaps, you know, we're sort of seeing children in schools, the connection with families can be difficult at times, and I think that's something we're really sort of mindful with in terms of how we engage, because I would, you know, it should be that actually you do know that, you know, we're seeing your child, that we've seen your child, this is how they've got, this is how they are progressing, etc. And there are key points that you would do that within the school, an annual review example, but that's not to say that, you know, any parent can't just pick up the phone and speak to the therapist that is going into the school, seeing their child, and we would encourage that interaction to be happening, because we're mindful that school can just sort of seem a little bit sort of distant in some respect for parents. Actually, you know, what is the occupational therapist doing for my child in the school? Well, if you don't know, you need to come and ask, but we also need to, we're acknowledging we need to get better at linking in with parents and making sure that we are, you know, available, we're accessible, and you have the right information.
And I think that for me is a really good point. Again, thinking about that self-evaluation, that I'd really urge parent carers out there to share their experience. Do you know the name of your physiotherapist, your occupational therapist? If, you know, are you really clear on the program? Do you know, we know, don't we, that a lot of the maintenance tends to happen with teaching assistants who might be trained by the physio or the OT to deliver a program.
Yes.
The physiotherapist isn't going to be in there every session. But Absolutely. As you say, if you have a concern, you should be able to phone your therapist, shouldn't you? I would really, really encourage all of you who are listening to this to share your experience. Do you know them?
Absolutely.
Do you not? And we need to know, don't we? If we hear from 100 parents and 80 of them know the name of their therapist, I think you'd be probably quite happy with that.
Absolutely. And you know, to share experiences, you know, what is it that you would like to know more about? Is, you know, is it simply just the name, or, you know, do you feel that actually you need to sort of, you know, regular updates, etc. I think I just want to sort of touch back on the point you've also just raised there, sort of, Benedict, which is really useful to highlight in terms of what the model that we provide is, you know, sort of working through others. So quite often, you know, we would do, you know, assessment, there'd be recommendations, then we would be working with the school about implementing them in that child's environment. So you know, some of these words are a bit terminological, but, you know, we very much offer like a functional approach. So, you know, it's about developing those skills and those strengths in the context that the child is in. So rather than, you know, bringing them out of a sort of class environment, throttling them and then putting them back. Actually, our model is more, well, they're in that class environment, they're dealing with all of those distractions or activities that are going on. How can they best engage? So it is important that we do that in the class environment. We can't be there every single day. The teachers are the ones that actually have that relationship. And of course the parents, I mean, that's fundamental. Of course the parents have that relationship. So I think it's about us making sure that, you know, we're supporting people to be able to give those opportunities to children to develop those skills, and also use the skills they have, because sometimes it's not just about, you know, developing new skills, it's about actually maximizing the abilities that they have in the first instance.
Absolutely. And I think that working through others model is something that as parents of vulnerable children, we can sometimes struggle with. I'm heartened by the fact that you see the model as parents should be able to communicate with their therapists. So just as a little example, one of the things I used to be a little bit concerned about was that my son's physio, if it wasn't done properly, could actually potentially harm him. And, you know, it's just those tiny little angles of, is the teaching assistant putting his foot in the right angle? Am I confident that the person who's delivering the therapy really understands and really knows? And I think that can only really be fostered by a relationship with the therapist. And the ability, you know, if I'm a bit concerned, can I phone the therapist and say, actually, I'm feeling a bit worried. Can you go in? Can you check? Can you reassure me? Can you teach me?
Yeah, absolutely, and that's it's totally understandable. You know, the sort of programs are sort of demonstrated to, so you know, to class teachers and to parents. But of course, we all know, you know, somebody can show us how to do something, and then the next day you forget about it. So you know, absolutely, phone, say, can we just go over that again? Can you just show me? I know our physios actually make quite good use of videos and photographs, etc., because again, visually, it's so much easier rather than trying to remember exactly where that foot needs to go or that leg needs to go. Actually, here's a picture. But I think if families are you know, want that sort of, you know, assurance, or just, you know, going over it again, or if they hear that schools would like it again, please, you know, sort of get in touch with us, because we're more than happy to be doing
Wonderful.
that.
Thank you. I'm aware that time is zipping by.
Yes.
And I think it feels like we've covered quite a lot today. I wanted to, you know, we talked earlier about the fact that we're hoping to make this a bit of a series, and we've mentioned the mental health team that we want to talk to, the specialist nursing.
So yes, specialists, yes.
And talking about the community paediatricians and developmental paediatricians. So we're going to make that a little bit of a work in progress, I think, aren't we?
We are, and you know, I'd ask parents out there, you know, if there are particular areas that they'd like us to focus on. We've come up with those ideas between us, but you know, we could be missing something. So again, you know, let's use this as an opportunity to say, what would you like to hear more about? You know, if there's something that I've said that I thought, you know, you thought, well, actually, no, I don't understand that, we need to explore that, or something that you think I was going to say that I've missed, then yeah, I mean, we haven't talked too much around sort of mainstream schools. That could be another area, because yeah, our therapists and our nurses provide servicing and support to mainstream schools. So I think when Benedict and I were talking earlier, we just came to the conclusion that we couldn't cover everything in 20 minutes. So let's think about a series, and I'm very interested to hear what parents want to know a little bit more about.
And I think the other thing that I would say to everybody is I will put obviously our Family Voice contact details at the bottom of this video, and we'll talk with Sandra about how we best contact things, but really to encourage all of you to share your feedback, share your stories, share your experiences of the community health service, all the good, all the bad, so that we actually get a rich, broad picture. What we're trying to do, we're hoping to make it as easy for parents to do it as possible, but we also need to make sure that all of the information comes to the same place. So I say,
and what sort of thought, just to add in terms of, you know, what's working well, what isn't, but you know, what would have helped you know, let's sort of think about, I'm very keen to develop these ideas in partnership with sort of parents in terms of listening from the stories and building on it, but also doing that reflection of, well, how could it be different? What would different look like?
And one of the things that I think will come back in another video because we've run out of time, but Sandra and I had a nice little snippet of conversation about the transition into adult services, which really needs looking at. But I think we need to leave that for another time, don't we, Sandra?
Yeah, I was going to say it's too much. We started by saying it's huge, and we're going to end by saying it's huge, but this is the beginning, I hope. So thank you. Thank
you so much for your time, Sandra. I really appreciate it. And it's been an absolute joy to have you and have your face, and I come back to, we're all humans, all trying to help the children in Surrey who need that help.
Excellent. Thank you very much. Bye now.
Bye.